Hello, we are beginning a series where we highlight innovations done by NC State faculty. Today, we sit down with Dr. Simon Rowe. Hi, Dr. Rowe.
Hey, Kyle. How are you doing today?
I am well, thank you. Before we get to the innovation, how about you tell us a little bit about yourself?
Okay, I'm an orthopedic surgeon, small animal orthopedic surgeon here at NC State. Been on faculty in what am I up to, 29 years now, and I'm excited to talk about one of my favorite surgeries today.
Yeah, so give us a little bit of the backstory on it.
So the innovation I wanted to highlight is uncemented total hip replacement in dogs. And many people might be familiar with hip replacement. It's the best way to relieve a patient of hip pain, both human and dog. And some of the implants are held in place with bone cement. But what we've found over time is that these can loosen. And because dogs with hip dysplasia can be very painful even at 1 year of age, these cemented implants have a potential to become unstable and loosen over the lifetime of the dog. And so uncemented implants are designed so that there is not cement, and in those implants, the bone grows into the textured surface of the implant and establishes a biological fixation. And this bond will usually last for the life of the dog. NC State led the way in developing these implants, and it started with work that Dr. David DeYoung began back in the 80s when he was a small animal orthopedic surgeon here. And he was heavily involved in a research project with some human surgeons who were looking at different ingrowth surfaces, and from that built up the clinical assessment in dogs, and also helped design the current commercially available system. The sort of next phase of the process was that the company stopped making the hips. They changed their line of research, and so Dr. DeYoung then began working with Chris Sidebottom, who's an owner of a company named Biometrics. That was the company that was making a cemented hip system for dogs. And over the next couple of years, they developed an uncemented system. The first of that system was implanted in a clinical case here at NC State in October of 2003. And we then held a workshop on the system in December of that year, and trained surgeons who were used to doing cemented implants in the art of placing the uncemented implants. Last year, I had a dog that ended up dying, and he had one of these hips in place for 15 years, and was walking around on it and very comfortable and doing really well. Dr. Marcel and Little, who is now at UC Davis, and myself, we've placed somewhere around 450 of these implants over here at NC State over the years, and complication rate is really low, somewhere below 10%, and even those we've been able to manage the complications and end up with dogs with very comfortable hips. So it's been, in my opinion, been very successful.
Yeah, that's very interesting. Well, thank you for sharing.
You're very welcome.